Hoyer. Congressman, thanks for being with Fox and Friends today. What's your reaction there to Speaker Boehner's comments that, they're looking for something even more than someone to be fired? They think jail time, asking for criminal action to be looked at.
Well, look, let me say this. Clearly, nobody wants to see people targeted by the IRS on their taxes. However, this is really turning into a witch hunt, frankly, to serve the base of the Republican Party. The evidence appears to say that they were things that were done that were not correct, they were wrong, that tried to simplify the way they culled out returns for review on both sides,
sure,
liberals and conservative. So the fact of the matter is we need to get to the bottom of that, but this constant effort to criminalize behavior just is a Republican pattern we've seen in previous administrations.
If I may, sir, it seems peculiar, though, that Lois Lerner did take the fifth and then went back to doing that again, preserving her right there to not share information. So how do we know that there's not criminal action if we haven't been privy or been given any information? Isn't that what Speaker Boehner is just asking for, the information to get to the bottom of what could be affecting, yes, conservatives now, but even liberals in the future if this sort of practice occurs in government?
Look, we think the activity that is alleged should not have occurred. Secondly, however, when you say no information, there are literally thousands of pages of information that have been given to the committee about this issue. So there's been very extensive investigation. Frankly, I think that Ms. Lerner's attorney, out of an abundance of caution, because the Republicans have been talking about criminal activity as opposed to trying to find out exactly what happened, he advised her not to testify. She has that constitutional right. Obviously, a lot of people say read the Constitution, know what the Constitution means, understand that the Constitution gives you protections against a big government, which is what a lot of people said. She's availing herself of that constitutional protection. Now, we ought to get to the bottom of it.
Sure.
The committee has spent a lot of time doing just that.
The committee, according to many, took too long to really get moving here. But in terms of the fifth, what's to take the fifth over? Sure, it's a constitutional right, but aren't those elected officials, including yourself, aren't y'all responsible for just getting to the bottom of it for the American people so they don't feel targeted, whether they're Republicans or Democrats, so their money's good and they're not targeted when it comes to their beliefs? Aren't we just trying to get to the truth here?
The answer to that is yes. Do you want to talk about some of the really important things that are confronting our country?
I do. Let's get there, because Maryland right now has certainly had its share of difficulties when it comes to Obamacare. Over 73,000 plans were actually canceled. I do know, in fairness, 60,000 have signed up there, many of them on the Medicaid end of it. What's the plan to make this work? I know you're trying to model things after Connecticut's exchange, correct?
Well, we want the exchanges to work, and the reason we want the exchanges to work is because the access to affordable quality health care is something the American people need, want, and have been advantaged by over the last few years with the Affordable Care Act protections, such as getting insurance notwithstanding a pre-existing condition, making sure that preventive care is not an extra charge to encourage people for getting preventive care. Seniors are paying less for their prescription drugs as a result of the Affordable Care Act. People aren't having their policies canceled because they get too sick, so they don't go into bankruptcy. So all of those facets of the Affordable Care Act are working and have benefited literally millions and millions of Americans, young people on their families' policies before age 26. So millions of people have been advantaged, and 7.1 million people have signed up, meeting the targets that were set.
Right, the 7 million. The 7 million sign up there, sir, that is also, yes, that's a sign up. It does not account for those that have lost plans, 73,000 in your state. I do have something, this is going to shock you, that we can actually agree on. We have to agree on Harry Reid here. I mean, when the rant with the Koch brothers saying it was un-American for them to get involved here, and those that have taken money from them just sort of ripping the heart out of Americans there. He went on his rant, yet we find out that he actually accepted donations for the Koch brothers here. Is this hypocrisy? Can we agree there?
Look, I don't know enough about that to agree or disagree. Let me say the Koch brothers have obviously made themselves a center of political attention. by contributing millions and millions and millions of dollars over the last 4 years, hundreds of millions of dollars, in fact, to press their political agenda. So clearly they were going to be an object of attention. We would hope that they're not trying to buy the government. They're trying to put forward their ideas. But the fact of the matter is they've made themselves a center of attention, obviously.
Well, and, you know, certainly Harry Reid has given them center stage at times, and they were down by, I think, 50 on the list of contributions in terms of politicians and donations there. Let's talk Paul Ryan and his budget. So I know you're asking that the CBO take a good look there and how his budget will affect those that are most vulnerable. So the question is, what's your beef with the Paul Ryan budget?
The Paul Ryan budget is a disaster. It's a retreat. It disinvests in America and America's future. It disinvests in growing jobs and creating opportunities for people. It is a budget that is more of the same. In fact, Hal Rogers, the Republican chairman of the Appropriations Committee, said last year that the budget was ill-conceived and unworkable and unrealistic. He can add to that, it's unchanged. The budget that was adopted or was presented last year and was adopted by the House but never implemented by the Republicans, never implemented, is a budget which changes Medicare, which undermines Medicaid and nutritional programs for people. It disinvests in basic research, it disinvests in infrastructure, disinvests in education, all of which are necessary to grow our economy and create the kinds of jobs that we need. So it is a bad budget. I don't think it reflects the priorities of the American people, and I think the American people are going to reject it, as the Congress, and this is an important thing, the Congress rejected almost this same budget last year. The Republicans in the House of Representatives never, I want to underline that, never offered appropriation bills consistent with their budget that they adopted. So that it's unfortunate that we're now seeing just a replay of last year's failure.
Well, you know, Paul Ryan actually stated here on the program that he's looking to cut $5.1 trillion, actually extend Medicaid throughout and make it safe for those who need that program to have susustainability there. I would love to have the two of you together, because he believes that the program that is now will just feed back into Obamacare.
Elizabeth, he cuts Medicaid deeply. That's health care for poor people. He cuts it almost $750 million. Excuse me, $750 billion. He cuts food for poor people, children who need nutrition. He cuts that by over $100 billion. So, Elizabeth, I'd be glad to debate Paul Ryan. This is an unrealistic budget.
Let's do it right here. How about this? Let's make a date then.
It's a political budget.
Let's make a date. We'll have the two of you here, and I'd love to have you both go back and forth with those CBO findings and on how it actually does affect those that you mentioned there. So, look, we love the discussion here.
Yeah.
Come with us again. I'm going to get the Ryan plan up and running on a board, and then we will discuss. Congressman, thank you very much.
And we'll discuss how it replaces Medicare with a premium support program and undermines seniors' Medicare. We'll be glad to discuss all those issues. Thank you very much, Elizabeth.
That'd definitely come out of your box. We'll hear something else out of his, and I'll sit and just try to make you friends, okay?
Okay.
Be well, sir.